Hello, so this video is for the head to toe final assessment. And we have here Miss American Doll to help me to be my patient. She is a 80-year-old female, and which will be documenting our assessment and findings for. So I first want to make sure that the room is comfortable. Check the temperature setting. You want to be a regular room temperature, 78 degrees or so, just so that the patient is um, comfortable. If they're too cold or warm, ask them and make the adjustments as necessary. So I have here with me my stethoscope and a pen light, and we've got blood pressure cuffs, but I don't think we could use that on Miss American Doll today. So I'll first come in the room, close the door behind me to provide privacy, make sure there's no one else that shouldn't be in the room. And I'll say, hello, I'm Nurse Kevin. I'm gonna be your nurse today. I introduce myself. I'm here to do a head to toe assessment on you. So we're gonna go basically from your head to the toes, and each step I'll be explaining what I'm gonna be doing today. Okay? Um, let's see. So we'll start with the general inspection. I'm gonna just take a look at your skin. Um, See that there's no signs of pallor or cyanosis, which would be your skin turning pale or spots of blue, anything like that. I'm looking for that. I'll assess the temperature of your skin, make sure that they're not too hot or too cold. Also, we're gonna check for turgor. So I'm gonna ask to take your hand. I'm gonna pinch up a little bit on your skin and see how long it takes to come back down. Gonna pinch a little bit, and we find that it's taking three or more seconds. It's taking 5 seconds for the skin to come back down. So that's findings of a poor turgor, and which it could mean that you're dehydrated or you've had a recent sudden weight loss. Have you had a recent weight drop? No. Oh, you must be dehydrated. That's why you have a IV hooked up to you, and we're gonna continue on. Um, so, um, can you tell me why you're here and what your name is? Oh, Miss American Doll, and I'm here because I fell and I get dizzy. Okay, so that's good. Can you tell me your date of birth? Okay, thank you. And I'll check that against your the name tape. And I'll continue on. So I'm gonna start with your head, as I explained. I'm gonna inspect your head and your hair. Uh, Feel for any bumps um, or any areas that are tender, and inspect your scalp. Make sure that everything's normal. Um, and I've palpated the scalp, and I'm gonna ask you to follow some instructions. And can you do that for me? Yes. So can you please smile, frown, now close your eyes tightly, and I'm gonna try to open it. I'm gonna try to pull up on her forehead. I'm try to open it. Okay, very good. And you lift your eyebrows for me, show me your teeth, and puff your cheeks. Okay, very good. Um, Now clench your jaws for me. I'm gonna put my hands on her jaws, um, and when she does that, I'm gonna try to bring down her chin, which I can't do. Um, I'm gonna take a cotton swab. This is a per se a cotton swab. Now, can you close your eyes? And when you feel a touch, say now. Okay. Go above the eye, below the eye, around the chin area. I'll do the same thing on the other side. Okay, thank you. Um, so this is a ophthalmoscope, and with this, I'm gonna check for the color, size, and the shape of your optic disc. Like this, turn the light on. Check the other side. Thank you. Now we're gonna check for your EON. So I'm looking at your pupil for size, regularity, equality, and light reaction and accommodation. Take my pen light, the actual pen light. Now go from the outside to in. Make sure that the pupils are dilating. Go from the other side. Thank you. Now, with your eyes only, I need you to follow the tip of my pen. Okay? I'm gonna go to the side, go to the cardinal positions. Don't think you can see that. Here we are. So from here, I need you to follow the pen and go right up and basically draw an H. While the meanwhile checking her movement of the eyes. Okay, thank you. Um, and now I'm going to just take a look at your ears. Make sure that there's no lesions or fluids build up on your ears. And that's your head. And then I'm going to take your light, look inside your ear. Check the other side also, please. Thank you very much. And I'm gonna whisper something next to your ears. Just I need you to say back what I said. Blue moon, 99. Okay, thank you. So I checked both sides of her whisper hearing. I'm gonna next check the nose and the mouth. I don't have an otoscope, but if this were an otoscope, I'll change the tip. Um, and look up and first inspect the actual external nose itself. Um, Make sure that it's symmetric and there's no lesions or anything like that. Then you want to look inside the nostril, check for any deviated septums or fluid buildup or mucosa. Then I'm gonna check for the check the mouth, check the external lip, and then take my little wooden stick, bring down the lip, check the inner line here and here by doing this. Um, and at the same time, you want to check for the gums, the teeth, the roof, and the floor of the mouth. So you say ah. When you ask the patient, say, can you please say ah? When they say ah, you want to observe the movement of the soft palate. So you're checking for your cranial nerve number 9 and 10. At the same time, inspect the pharynx, make sure that it's not swollen or there's any inflammation. And then to check cranial nerve number 12, the tongue movement. So I would say, can you please stick your tongue out? Which will go like this. And move it side to side. And then please say light, light dynamite. Light, light dynamite. And as she says that, make sure that she's pronouncing all the T's and the D's. I'm gonna move on to the neck. So I'm gonna first inspect that the head is centered in midline. The accessory neck muscles are symmetric, and the head is held erect and still, like she is now. I'm gonna palpate the occipital pre and post auricular, which is starting here behind the neck, on top of the neck, and to the front. I'm gonna palpate for any lumps that may be there. I'm gonna move down, move along the jaw, on both sides, along the jawline, and then down the neck on the side. And then I'm gonna check for the range of motion of the cervical spine. So I would ask the patient, say, please touch the chin to the neck, rotate left to right. You could actually do that. And can you please now touch your ears to your shoulders? And now I'm gonna check the cranial number 11. So against my force, can you please turn your head to the left, and I'll push, put pressure on her right side, and she'll try to turn, and then she'll do the opposite on the other side. And now I'm gonna put my hands on your shoulders, and can you please shrug up? Shrug like this. Okay, so we're gonna now move on to the breast. So I want to first inspect the breast while the patient is in a sitting position. Also want to inspect the nipples. So when you're inspecting the breast, you're looking for size and shape. It's okay to have a little bit of asymmetry, and sometimes it's a little bit larger on the left. And you want to check for the skin condition. Make sure that it's smooth and it's even in color, and the nipple line should be basically at the same plane from the left and right bilaterally. And next thing I want to do is I'm going to palpate the axillary in the sitting position. So what I would do is take my left hand and grab the patient's left hand, hold it up and support it so that the muscles are relaxed. And you want to check for forelanes. Take your hand and check down the side, the posterior, anterior, and the inside part of the where the bicep and the triceps are. I'm gonna do the same thing on the other side. Use my right hand to support the right hand, and take my left hand and palpate the same way as I did on the other side. Next, I'm going to help the patient get into a supine position. So she's gonna lay down in a supine position, and the current recommended method, according to the textbook, is using 3 pads of your fingers and going in a vertical strip pattern, and as you're palpating, go in a circular pattern, up, down, next up, and down. So I'm gonna palpate for any lumps that may be present in both of the breasts. In our case, my patient 30 years ago had a mastectomy, so she doesn't have her breasts anymore, but she's a cancer survivor. Next, I'm gonna check the thorax and the lungs. So here I'm gonna inspect the rate of her respiration, and that's something that I would do during my vital signs checkup. You don't want to let them know that you're counting their breaths, because that may lead your patient to change rhythm and effort. So it should be effortless for the patient's breathing. And I'm going to now auscultate the lung sounds from my stethoscope. So I'm going to act like I put it on because I can't hear myself. Take my stethoscope. You don't want to go over close. So it should be in a gown, and it should be taken off. I'm going to auscultate the lung sounds from above the collarbone area, because that's where the top of or the lungs will be present. You want to go basically listen to full breath. Full breath. So I'm going to ask the patient to take full breaths. But if she feels nauseous or dizzy or feels like she's going to faint, I'm going to ask her to tell me so I will stop. Because some patients may be wanting to be too good of a patient that they may go into hypoventilation or hyperventilation, trying to listen to our instructions. When you're auscultating, you're going to go side to side, work your way down, basically comparing the sounds of both sides, listening for any crackles, any adventitious breath sounds, wheezes, anything like that. And when you're checking for, when you're auscultating, you want to make sure that the legs are not crossed, they're sitting comfortably. And I'm going to help the patient up. I'm going to ask the patient to lean forward a little bit, put their hands on their knees, and relax as I auscultate from the back. When I'm doing this, I want to make sure that I'm avoiding the scapula, because you won't be able to hear as well. And that's that. So that's auscultating the lung sounds. Next, we're going to move on to the cardiovascular. So we're gonna listen to her heart. The traditional 5 points would be at your apical, pulmonary, earth point, um, uh, mitral, and too much, and tricuspid, tricuspid and mitral. The new way that we were taught is to either go from the tip of the heart and work your way up in a rough Z pattern, or do the opposite. So we'll do that. Listen to the hearts. Listen for obviously your S1 and S2 sound, and listening for any extra heart sounds that may be there, like your S3 and S4. You want to ensure that that's not there. Um, and when you're doing this, also use your diaphragm to listen to your high pitch sounds, and your bell for your low pitch sound. When you're using the bell, you want to push in a little harder. That way, it creates a seal, so you can listen to those lower pitch sounds of the heart. I want to also auscultate the carotid, which is the carotid artery here. And when you're doing this, and if you're going to palpate it, you don't want to palpate both at the same time like this. If you push down a little too hard, it cuts off the blood circulation to your brain, and your patient will faint. You don't want to have that happen. Now I'm going to take off my stethoscope and assess the capillary refill. So you take your fingertips, push it down, and it should turn white, and it should return the blood flow and the normal color within 2 seconds. You do that with your fingertips and your toes. So basically, doing this, making sure that color comes back within 2 seconds. So mine's pretty good. And then you want to palpate for all the pulses bilaterally. So you want to check both sides. So when you're out of the carotid, you can check both sides at the same time. I would personally check the radial first, and then work my way up, because if there was a radial pulse, there should be a brachial pulse as well. So you want to check your radial pulse, brachial pulse, and then I would go from the feet. So I would go to the dorsalis pedis, posterior tibial, your popliteal, and your femoral arteries. You want to check that blood flow is flowing through the body. So we're going to move on to the abdominal. With your patient laying down in a supine position, you want to inspect the contour of the spine to determine whether the spine formation is flat, rounded, scaphoid, or protuberant. Also want to make sure or look for symmetry. Also take a look at their skin, the umbilicus. Some younger females may have a piercing in their umbilicus, so you want to make sure there's no reddening or inflammation of that sort. Our ADO patient does not have a piercing on her umbilicus. You also want to look for even skin tone. Look for any lesions. You also want to take a look at the hair distribution. So in a female, it should be a reverse diamond shape. And then here is a little different. Before you palpate, you want to auscultate for bowel sounds first. The reason for this is because if you palpate the bowel, it may cause bowel movement and give you undesired auditory responses. So you want to basically start from your right lower quadrant, where your large intestines start, and you want to follow your colon. So you want to go from right lower, right upper, left upper, and basically your left lower quadrant. You want to work your way up. Listen for bowel sounds. There should be 5 to 20, 5 to 30 bowel sounds per minute. The count isn't important. You just want to make sure that there is movement. And one of the reasons also why you want to start at the right lower quadrant is because you'll almost always hear something there, and then if there's an occlusion, um, you'll find it on a further way down. You want to look for something that you could hear first. And work your way down. You auscultate for that. You also want to note any vascular sounds, and what you want to look out for is bruit. So over here you would have your femoral artery that you could auscultate. You could also listen to your iliac arteries or your renal arteries. Towards the middle, you should be able to hear the aorta. You want to auscultate for that and look for any abnormal sounds like bruit, slushing of the blood sound. Next, we could palpate the abdomen. What you want to first start doing is general percussion of the intestine area. Look for hollow sounds. And from there, you could line out your liver. Listen for your dull sounds on the right side, and then check for your spleen, which also should be a dull sound, which is on the left side over here. So you percuss the intestine, liver, the spleens, and then you want to test for ascites. So if there's a sign of edema, ask your patient if they could bend their elbow to put their hand in the middle of their abdominal area, and you want to push from the side and look for any wave-like movements that may be there. And that's what ascites is. We're going to move on to the musculoskeletal. So you want to inspect the spine and palpate it. Ensure that it's in a straight line. There's no curvature, or there should be a curvature. There should be a normal curvature. And then want to palpate and the upper and lower extremities. Make sure that there's no lesions. Again, any cuts, heat due to inflammation, and determine the range of motion. So you want to do your basic range of motion tests, having their arms go, have the patient move their, so active range of motion, have the patient do as much as they can, have them move their arms back, bend their elbows, turn their wrists in all directions, and you want to make those recordings of the degree. Legs, knees, ankles, you want to check for all their range of motions, active range of motions. Okay, and then we're going to neurological, test for vibrations. So what you want to test for is you take your vibration, I forget what it's called, the ring thing, looks like a U, I'm sorry, I don't know the name of it. You strike it against your hand, it vibrates, you put it against a bony parts of their body, like their feet, knees, top of the heads. Ensure that they can feel the vibrations. And if the patient can feel it in their most distal part, you won't have to go any further, because if they can feel it here, they should be able to feel it up their legs. You want to check for that in the extremities and your cranial nerves. You also want to test for light touch versus pain. So you would have a stick with one sharp end and one dull end. Have the patient close their eyes, and you would switch back and forth and ask the patient if it's sharp or dull. So you test for pain and light touch there that way. And then you want to check your deep tendon reflexes. In the arm, there are 3. So you have your biceps. You hold their upper arm and strike your reflex hammer here, and look for the biceps coming up, and check your triceps. I'm sorry, her arm doesn't bend. So your triceps here, hold it up so that the lower part of their arm is relaxing. You take your hammer and strike here, and look for a reflex coming up this way. Let's see. And then you have your deep tendon reflex on the knees while the patient's sitting with their feet dangling and legs relaxed. You want to hold the thigh of the patient and feel for the tendon that will be at the below the kneecap and strike that. And then you also want to check for the deeper reflexes in the Achilles and your plantar. So you basically want to draw like a reverse J shape at the bottom of their feet, and their toes should flex. What you don't want, the abnormal finding would be Babinski sign, which you will find in a newborn, but where the toes instead of flexing, they would go the other way. Then you want to test for coordination, so you would do the finger to nose test. So for that, have the patient close their eyes, stretch their arms out, and point their finger onto their nose, back and forth on both sides. You could also do the finger to finger test. You have the patient touch your finger to the nose, finger to the nose. You do that a couple times, and then you move location of your finger. See if she could comply with that task. The heel to shin exam is where you would have the patient lay down, take the heel of their foot, put on their shin, and run it up and down. And they should be able to comply with that task as well. And the rapid alternating movement, for that, you have your patient put their hands on their knees and at the same time raise their hands up and flip their hands, put the dorsal side of their hand onto their knees and flip back and forth multiple times. Another thing you can do is have the patient work up and down their digits of their fingers and touching each one back and forth to their thumb. And to do the Romberg test, have the patient stand and close their eyes and just stand there. You want to make sure that you're nearby, ready to catch them in case they lose their balance. But if you note that they widen their stance or they take a step and they try to brace themselves even further, that's a sign of them not having good balance. You want to observe their gait. So you say, "Hey, Miss American Doll, please walk down the hall. When you get to the end, turn around and come back to me." And you want to test for their gait. Make sure that they're well balanced. They're not tilting to one side or the other. And that will be it. That will be your neurological. And during the whole time, you want to make sure that you give them their due dignity, their privacy. That will be it. Thank you.